I can hear you now. How are you?
I'm fine. How are you?
I'm good.
So, currently you're in Ohio?
That's correct, yes.
Okay, okay. So you're basically from Ohio. You're not from Florida.
Correct.
Okay, okay. And I was just reading your medical records and history so far, and you have been seen at Ohio State University, right?
That's correct.
And Dr. Amen saw you and did some workup.
Correct. So he was the transplant doctor,
Okay.
and then Dr. Mems was the oncologist that I was seeing there.
Okay. So, if I would like to know what they have been telling you and in what ways I can help you.
So they told me I have MDS, so I definitely want a second opinion on that, because I have heard that it's highly misdiagnosed. So I would definitely like a second opinion on that, and I also heard that the Mayo Clinic, if it is MDS, is one of the top hospitals to go to.
Okay, and thank you for your words in regard for the Mayo Clinic. And so, in terms of symptoms wise, you just start to have these symptoms few months ago?
Yep, back in December. Now, I had been sick a lot in 2021. I just wasn't putting two and two together. I just figured everybody's getting out and about, getting more comfortable with COVID, and I'm just catching everything. And it wasn't until I seen my numbers, and they started asking me questions about the past year, where I'm like, yeah, I guess I was sick a lot for 2021. But the symptoms really showed up in December. I was just having a lot of abdominal pain, fever.
Okay. And so they found a mutation, DDX41,
right,
which is linked to some germline predisposition runs in families, and they did send you to a germ, like genetic counselor.
I have an appointment with one of them on Thursday.
Okay, 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 okay. And are you married?
I am.
You have children?
I have three.
3 children. How old are they?
12, 18, and 23.
12, 18, and 23. Okay, okay. And you have siblings?
I have one. He's 40.
One sibling. Brother, 40 years old.
Yeah, and he lives there in Florida.
And your parents are?
I have my mom's still alive.
Sorry?
My mom's still alive.
Okay. Your father is
deceased.
Disease? What was the reason for?
Prostate cancer.
Prostate cancer. At what age he was diagnosed?
58.
50, okay. And so how long did he live with this diagnosis, prostate cancer?
What, 4 years? About 3 years.
3 years. Seems like an aggressive kind of prostate cancer. Usually people live quite long with this diagnosis.
Yeah, they caught it late. They caught it late. And he had ataxia with that, so the symptoms of that.
Okay. I'm sorry for it.
Thank you.
Anyone in the family with blood cancers or other cancers?
Not blood cancers. There's been breast cancer, colon cancer, prostate cancer. Did I get them all? I think those are the three.
Who had breast cancer?
My great aunt.
Great aunt. At what age?
60.
60. And colon cancer?
That was my great grandma. Right.
Okay.
And she was about 72.
72. And prostate, your father?
Correct, 58.
Okay. Okay. So, yeah, so it's unlikely to have MDS diagnosis at your age, right? It's MDS is a disease usually of elderly people, like the median age is around 65 to 68 years. So it's unlikely to have this disease at your age. But in some people who have germline predisposition, like who had some genetic hereditary abnormalities, that can happen at a younger age.
Right? Gotcha, okay.
And DDX41 is kind of those germline mutation that are linked to familial history of solid like breast cancer, colon cancer, and liquid like MDS and other kind of cancers. I've been studying about this DDX4 mutation with our colleagues from Rochester over the last year, and we have compiled data and presented. In this scenario, DDX41 tends to have a very indolent course. They are not very aggressive kind of mutation. And we have few cases, even with this diagnosis, they didn't require treatment for years. And they stay in that dormant phase for years before something could happen. So if it is MDS with DDX41 mutation, the outcome is better compared to other people with other mutations, right? Provided that we ruled out any other genetic abnormalities occurring with this DDX41, right? And you rightly mentioned MDS can be misdiagnosed and it has to be evaluated and reviewed. People who see these kind of diseases more often and use that. So that's right decision. In terms of, you mentioned that you had these infections over the last 1 year. Any other symptoms that you could recall?
No, just because I didn't even know anything about my blood being so low until I went to the hospital in December for those other symptoms. And fatigue. Fatigue is my biggest complaint out of this whole thing, for sure.
Did you receive any blood transfusions so far?
No.
No.
I've had iron transfusions, but no blood transfusions.
In terms of your energy, in terms of your daily activities, is there any restriction with your fatigue and all?
Yes, very much so. A lot of my days consist of going to bed, and when I wake up, coming to the couch, and then going to bed. Like I have better days than others. On a semi-good day, I can sometimes get a load of laundry done, and that's usually it for the day. Once I do one load, I'm done. Today I'm feeling much better. I have really bad days too, where I can't even get myself out of bed because I'm so weak.
Okay. Any night sweats or anything?
Not in a while. I did have quite a few of them over the past couple months.
Okay.
But I also had a fever at those times.
Okay. So yeah, it could be related to this MDS, and your counts are really low. Your hemoglobin is not at the level we usually transfuse it, but hemoglobin falls below 8. But your hemoglobin, I was seeing, like when it all started, it was 8.7, and the most recent one on 17th of March, you had was 11.3. So that was good. No transfusion, right?
No.
11.3 is without. Okay.
Correct.
Okay. And your platelet counts are 118, not bad. And your white cell count, your neutrophil count is 0.90, which is low. And apart from that, your other counts are stable. They're not like something that we should need to do right now. You know what I mean? So, and how frequently are you getting your labs checked?
Not that all. So I went this past Thursday because I talked to the transplant doctor and they ran them then. And prior to that, the only reason it was ran is because I got admitted to the hospital like a week prior to that.
What was the reason for admission?
Fevers that wouldn't go away.
Okay.
But they didn't find anything, no infections or anything.
Okay. So what you guys going to do right now is I will ask the slides to be sent to us for review. The bone marrow biopsies you had at Ohio State University. It takes some time to be sent to us.
Okay.
Once it's reviewed. It may take a week or 10 days once we review those. And the second thing I will do is we do meet with our leukemia colleagues from all three Mayo sites, Rochester, Florida, and Arizona, once every 2 weeks, and we are having this meeting tomorrow. So I will discuss among those people what needs to be done.
Okay, that would be good.
Looking at this mutation in general, if we don't find any other mutation, then transplant is the way to go. But now I've seen the mutation and seen that people are doing better with less intensive approaches and observation. We could have some more discussion and review the bone marrow slides before we come to any conclusion. I would say at this point in time, there's no rush to start chemotherapy, so just hold off on that.
Okay.
Until I gather more data and discuss with my colleagues, and then I can have another virtual visit in a couple of weeks' time. By that time, we'll get the bone marrow biopsy slides to be reviewed. I will discuss with my colleagues, and we'll get back to you.
That sounds great. I really appreciate it.
No problem. Yeah, so it is something which is spark interest, and I've been seeing patients with this mutation. So let us discuss, and I will get back to you with some more answers. Meanwhile, I would say just go ahead and see a genetic counselor and see what they say.
Okay.
They set up a better pedigree. I'm up for that. Go and see a genetic counselor. Meanwhile, we do this review and discussion.
Okay, I will do that.
Anything else?
Let me look at my list here. You answered a lot of my questions. No, I don't think so at this point. I think it's just gonna kind of determine on once you guys get the bone marrow biopsies and able to look at those and.
Sure. Okay, so we'll be in touch. If anything arises in between and you want to reach out to me, you can set up a patient portal and send me a message.
Okay, that's great.
I'm happy to get back to you.
Okay, that sounds
Okay.
good. Thank you so much.
You take care, okay?
You too.
Sorry, one thing I wanted to ask you. Any history of smoking?
So I used to smoke. I haven't smoked in years. I smoked for like a year and a half.
You quit smoking a year and a half ago?
No. I smoked for about a year and a half.
How long ago?
It's been about
almost 5 years now.
about 5 years.
5 years ago. And alcohol, any excessive alcohol drinking?
Not since December, but I was drinking a lot of Fireball prior to that.
Fireball? What is Fireball?
It's a cinnamon whiskey.
Okay, and how much you were drinking?
So on the weekends, probably about 6 or 7 shots.
Okay. And how long you did this drinking like this? 6 to 7 shots?
Probably about a year and a half, 2 years. Well, not quite 2 years. Probably about a year.
Yeah, but now you're not drinking that much.
Yeah, I'm not drinking at all.
At all. Okay. So we'll get back in 2 weeks and let us do some more review, and then we'll get back to you.
That sounds good.
Okay, and if neutrophils drop below 500, I would recommend to start an antibiotic Levaquin. Are you on an antibiotic?
Yeah, they have me on an antibiotic, an antiviral, and an antifungal right now.
Okay, that's fine.
Okay.
That's fine for now.
Yeah, and the Levaquin is one of them. Yeah.
Okay, talk to you soon. You take care, okay? And let me know if you need anything.
All right, perfect. Thank you so much again.
No problem. Take care.
Bye-bye.